Okay, this evening I'm here with Dr. Jeff Wiegers from Biomedical Reset. Dr. Jeff is an expert in stem cells, and you might be wondering, why am I covering that on this channel? Well, I'm covering it because there's been a recent innovation. There's been the discovery and the use of something called Muse stem cells, which is really hot right now. I mean, it's being talked about, and I am particularly interested in this because I'm curious about its use in drug injuries, specifically protracted withdrawal injuries from medications, potentially even things like PSSD. I want to say a disclaimer right now, Muse cells, stem cells, all of that. These are experimental therapeutics. I mean, these aren't approved, by the FDA or anything like that. But the level of suffering from these conditions is such that many of the people I work with, they're willing to try things for help. And I don't actually, from what I've read about these things, I don't think they're that dangerous. But we're not going to go off me because I'm a bit of a dilettante here. We're going to go off what Dr. Jeff, who really is the expert on these, is going to teach us about them. And so, Dr. Jeff, thank you so much for agreeing to come on and give my audience, a state-of-the-art, an update on Muse cells and their potential role in neurological damage. Thanks.
No problem. Great to be here. I'm excited to talk about this. And like you said, I think stem cells are a space that's slowly being more and more adopted. This all falls under the umbrella of what I'd call regenerative medicine, which is just kind of a different ethos towards medicine. We're really trying to help the body rebuild itself in any way possible, whether that's diet, lifestyle, supplements, and then at the higher level, we have things like stem cells or peptides that people might be hearing these words more. So yeah, the goal is to just shed a little clarity and tell people about the power of these things.
Great. So where I want to start actually is here, because this was the study that got me excited about this. This was from one of the publications on the Muse Cell Innovations website. It was a randomized, double-blind, placebo-controlled trial where they enrolled patients who had an ischemic stroke. And what they did was, one group got Muse cells and another group did not. And then they assessed kind of the recovery, it looks like over 12 weeks. And here's what they found here. They found a 40% response rate in the group that got the Muse cells compared to a 10% response rate in the placebo group. And I'm thinking, that's quite incredible. And I know this is a small study, and I was looking at quite a few of the other ones on the website, not placebo-controlled or randomized, just open-label studies, whether it was with people who had spinal cord, their spinal cord was severed, or they had things like ALS, and they were trying to see, what would happen with amyotrophic, Lou Gehrig's disease, see if they could kind of slow down the progression of that. And it was looking like there were actually some signals that this was working. And these are serious neurological problems. And so to me, this is actually something that has some teeth there. And I'm usually pretty skeptical about bringing these things forward on this channel because there's so much desperateness in, wanting a solution. But I do think this is something that we should look at. And, I think before we dive into the discussion, because I know I know at Biomedical Reset, you help people who have TBIs, you help professional, sports stars, things like that, who have concussions. And so you have some experience there. But before we do that, I want to just do a level set for the audience. Could you just give us a stem cell 101 and then maybe link to what Muse cells are and why they may be of particular interest in neurological damage?
Sure. So a stem cell is really any cell that's not differentiated. The way I think of this is, say you have a kindergartner or high schooler, they haven't chosen a job in life yet, and a stem cell is the same way. It hasn't gone down any cell lineage pathway to choose an ultimate fate. So a liver cell's determined its pathway. It's now a liver cell. Skin cell, same thing. A stem cell still has chosen no pathway. Therefore, it can become different lineage of cells. We typically decrease in the number of stem cells we have ourselves as we age. So they get used up for different things, for healing our body, for maintaining over time. when you talk about stem cells in the actual therapeutic space, they've been around for a long time. The FDA approved indication is for the treatment of leukemia. You can do a stem cell transplant where you take the bone marrow of one person and you put it into the bone marrow of another person, and you're replacing then their stem cell population inherently. But so there's different levels of pluripotency as well, as what we call it. Pluripotency meaning a cell that can become different types of cells. There's something called totipotent. This can become anything in the body. There's pluripotent, which essentially is close to the same. They can go down many, many germline layers. And then there's cells that have chosen their lineage. So then the other differentiator to know within the stem cell space is there's something called autologous and there's something called allogenic. So an autologous cell would be if we take a patient, we take their own bone marrow, we isolate or any area, you can find stem cells within fat, you can find it in bone marrow. These are some of the more common locations, and you isolate those stem cells and then you give it back to that same person. That's called autologous. Allogenic is you're giving products from one person to a different person. So this is important to understand. And both of these have been studied to some extent. And when people are looking at allogenic from one person to another person, typically they're going for younger lineages of cells. Most notably and popularly, people will use the umbilical cord. So there's a lot of talk out there about people, say, going to Mexico and doing stem cell therapy. Most commonly, what they're talking about is using umbilical stem cells. And so these are cells that are donated for scientific research, and laboratories will have them. They'll culture these cells out and then they'll use them therapeutically for people. This is, a few decades that sort of research has been going on, and people have looked at things like osteoarthritis, neurodegenerative conditions, skin conditions, everything. The research has been a little bit mixed. There's some promise there, and certain things it's better than the others, but there hasn't been a total mastery over how to utilize stem cells yet. Some people, you'll hear stories where it sounds like one person got this tremendous miracle result, essentially, and then someone else says, I got them, they didn't really do anything. So we've been pushing forward to try to understand what is it, why do some people are these outliers and they get a better result than others, and why is it that sometimes it falls a little bit flat? When are stem cells good? When are they not good? It's obviously a bit dramatic to think that something would be the perfect cure to everything. So we're trying to differentiate that. Where Muse cells come into the picture there is a Japanese scientist, Mari Dazawa, and she was working with stem cells, and she noticed at some point these small clusters of cells that were particularly resilient and able to survive. So she started to study them and characterize them and look at what their functions were. She called them Muse cells for multilineage differentiating stress enduring, because she found that they could become many different cell lines, so pluripotent. And then she also found that they were very stress resistant. From there, she studied these further and further, and there's been a few all the way to the point of human trials. So the way that people start is they start at the bench side, they then move on to animals, and then eventually we reach human trials. And she's done 5 or 6 human trials at this point. And she's displayed a number of different characteristics that are particularly interesting for Muse cells. But that's sort of the frontier where we're at now. One thing to understand is we all have Muse cells in our body. They are this special type of cell that anytime we get injured, they deploy from the areas where they're resting, particularly bone marrow is probably the highest density, and they go on site to injure or to different sites of injury to help heal that site.
Mm-hmm. Yeah. And when we were talking earlier, you said they were almost, particularly Muse cells, they track out injury better than the other stem cells, and so they're kind of like these heat-seeking missiles for injured tissue, to use, my level of understanding about it. So now, sorry, go on, Jeff.
So it makes sense. This is the way injuries work. Is say a cell gets damaged, it's going to release a signal, which is going to set off a cascade. there's something called S1P or sphingosine 1 phosphate that's released primarily from platelets and endothelial cells whenever they get damaged, and that starts a distress signal. The way I think of it is it's kind of like a 911 call goes out, and then the Muse cells are these ambulances that they're laying in wait. They're kind of preserving themselves, and when they see that the concentration of the blood of S1P has risen, they then deploy and they seek out that area, just like you said, of injury.
Yeah. Now, I think you hear like Joe Rogan and UFC fighters and all, and athletes to go on to Mexico and they're getting stem cells for their injuries and such. And I hear that it's mesenchymal stem cells seems to be the type. Now, when I've heard of like people in my community with protracted withdrawal getting them, they'll go down and maybe they'll work for like a little bit and then they wear off and then they feel like they have to keep on going to get that effect. And, I read that sometimes that happens with the mesenchymal stem cells, and maybe there's like an anti-inflammatory property to the treatments as well that's been helpful. And then someone explained to me that, maybe these Muse cells, that the mesenchymal cells, they may be less good for neurological damage because they don't cross the blood-brain barrier. They don't track the injured tissue as well. But that's different with these Muse cells. They can cross the blood-brain barrier. They can get to damaged neurons, and they actually may, on top of just the anti-inflammatory effect, they're going to be more likely to actually help heal and also become new healthy neurons. Is there some truth to that? What I've been hearing, does that sit right to you? Having studied this.
100%. Yeah. So I'll split this kind of into two explanations here. One, we'll talk about traditional mesenchymal cells, and then we'll talk about the difference when we're talking about Muse cells. So in a traditional mesenchymal cell, mesenchymal essentially is meaning it's originating from the mesoderm, which is a lot of the structural tissue of the body. They're easy to isolate from the umbilical cord. They're great for things like bone, fat, cartilage, muscle, tendon. These cells, there's two things that are important to know. One, if you give them through an IV, they are large in mass. And so typically most of these cells do get caught in the capillaries of the lungs, which once they're caught there, eventually they're going to die. They're not going to survive in that sort of space. That being said, these are young, healthy cells. And in that process, they typically release a lot of good factors and things that can be very rejuvenating for the body, but that's also why it can be somewhat transient. If someone's dealing with an acute injury, maybe you give them an IV infusion of these stem cells, they get caught in the lungs, they pop, they release a lot of good stuff, but maybe that's all they needed, and they're able to, if they're young and healthy especially, maybe that's all they needed to recover. Another factor is your immune system is always looking out for foreign material. So when you give a mesenchymal stem cell, it is eventually, they have some properties of immune evasion, meaning they can kind of tell the immune system, hey, nothing to see here. But eventually they are destroyed by your own immune system. They do get rejected. In the same way that if you gave someone a liver transplant and they weren't matched and on immunosuppression, that organ would eventually get rejected too. This does happen with traditional mesenchymal stem cells. What we're hoping for when people use regular umbilical mesenchymal stem cells is that they're in the body long enough to have an effect and maybe get the job done. Another misconception is people always ask, are stem cells actually turning into the building blocks to build new material? When we're talking about mesenchymal stem cells, they're mostly doing a traffic control job and signaling. So if there's a cell that's struggling and a stem cell is there, it goes to that site and it'll maybe produce things or donate things for that cell that it's trying to help, but it won't, as far as we know at this point in time, become that tissue itself. Now, switching over to how Muse cells work, Muse cells have a couple unique properties. For one, when I was talking about the immune rejection, they display something called HLA-G, which is the same surface receptor that the placenta has when a mother's pregnant. So when a mother's pregnant, that baby is technically foreign material within the mother. There's a receptor, though, that's expressed that says, I'm an ally, don't destroy me. And Muse cells, they have been characterized to express that same receptor. This is why you can give them from one person to another without rejection. And the first studies on Muse cells were done around 2010. And from that point, we've seen that people still seem to be able to maintain Muse cells that were given to them in those early studies. This is a major factor. First of all, that's a huge step forward to be able to give a cell to another person and it not be destroyed without immunosuppression. Secondly, like I was saying, the pluripotency, there does seem to be some ability for Muse cells to morph into the tissue that they're trying to heal. So for example, if we're talking about nerves, say a nerve gets damaged, it's in distress, maybe it's actively dying, a Muse cell can come to that area and it can consume that cell. And based on the DNA and the epigenetic pattern of what that cell was expressing, the Muse cell can then differentiate into a cell. It sort of replicates or mimics exactly what that cell was and plays the role of that cell. And yes, like you said as well, there seems to be evidence that they're capable of not only bypassing the capillaries in the lungs because they're small enough, but they can also bypass into the blood-brain barrier. And this was seen in essentially in the trials that they did on humans and even in the animal studies that they were able to make it to those targets, which would make sense just thinking about it. If you have these cells in your own body and say you have your own injury, you would hope your own cells could cross through and make it to that end goal.
Yeah, it happens with immune cells. And so let's shift gears now. I want to hear about the experience of you and your colleagues in treating different kinds of neurological conditions. Just anecdotally, I know this is an emergent technology. What have you seen? And let's not just focus on the positive. We want to hear, good cases. We want to hear, cases maybe where it didn't work out and what they looked like, side effects, all of that. Just give us your honest lay of the land of, what your experience has been like using these Muse cells on patients.
Absolutely. Yeah. So, first of all, I'd like to say that we're still characterizing actively what are the uses, what are, things that are a little bit lower on the scale of benefit for these. And I'm fully an advocate for actually doing clinical trials. It's something very difficult and it takes a lot of time. And obviously people are looking for therapies now because their lives matter and they don't have all the time in the world. But that being said, things that I find Muse cells to be the most powerful at typically fall more towards the acute or new injuries as opposed to things that are chronically degenerative. And I'll explain there is benefit on the chronically degenerative side, but acute injuries, they seem to be specialists at. So when I say that, I think things like stroke, heart attack, active tears in muscles, tendons, an injury acutely to a kidney or something like that. These injuries are the types of things that set off a big inflammatory response. And I think that's necessary for Muse cells to activate and to reach their end goal. Things that I've personally seen, it's typically hard to capture things in the regenerative medicine space right now, like stroke or myocardial infarction, because these people are usually in some sort of hospital setting. And due to FDA regulation, we're working on, building out clinical trials and studies so we can have that sort of access, but tougher to work with. I've seen a lot of benefit in musculoskeletal patients or patients dealing with current inflammation. So say someone with Crohn's disease and they have an active ulcer and their gut's totally inflamed. If we give them an IV therapy of Muse cells, typically it's fairly rapid that they'll see some degree of benefit. And we know this because you see some flu-like or raise in temperature, a little fatigue, the body kicks into a mode, and then typically healing will follow that. Neurological applications, things like concussion and TBI are perfect for Muse cell application. That's a acute event. There's neural inflammation. You give an IV therapy of Muse cells. It's very rejuvenating. I've had some patients say that it kind of feels like cold water pouring over them, the way they feel that the inflammation dissipating and the regeneration working. To speak a little on the end of things that I would say less beneficial, chronic degenerative conditions can be tricky. Things like osteoarthritis. This is one I work in this area a lot. It's something I wish I could say this was the magic bullet for. Is there going to be benefit? Typically, but we're talking more about cellular rejuvenation than tissue reappearing that's been lost. For example, I work with the spine a lot. If you've lost your intervertebral disc, it would be wishful thinking to say that Muse cells could make it reappear, or that any sort of stem cell at this point in time could make that reappear. Typically, we're working on making it feel better. In the bucket of things like ALS, so one of the Muse cell studies was on ALS itself, and ALS is a chronic degenerative condition. What they saw in that trial was 4 out of 5 patients.
Maybe just for our audience that isn't familiar with ALS, just, a couple sentences just about what it looks like, how it progresses, just so they can follow along and sort of understand that this is like an ongoing disease process. I think that's important for people to understand that that's happening underneath. Yeah.
Totally. No problem. So ALS is a tricky one because the inciting causes and the underlying, what mechanism of what's going wrong is not fully understood. But what we do know is something sets off a cascade where nerves start to die off. Typically nerves in the central nervous system are dying. And once nerves die, people may know that nerves are very bad at regrowing or coming back. This is why people with, say, spinal cord injuries, that can be a lifelong thing because nerves are particularly bad at regenerating. So the way ALS usually presents is there's some degree of low-level weakness, whether that's in the hands or the feet or some sort of motor function. And this progresses typically over years and slowly to the point where in the end, people have trouble breathing or they are losing so much motor function. It's a very, very difficult and tough disease. This is one that in the traditional medical system, there's not many treatments for right now. We're really, really working on finding solutions to this, and also in the regenerative medicine space. So at the moment, if you could even slow down the progression, that's a bit of a win in this bucket at the moment. And what we've seen in the Muse cell trial is exactly that. We saw 4 out of 5 patients have slowed progression or even mild improvement in symptoms. This leads to the question, well, for one, we still need to solve that underlying cause over time, but what we're doing is really buying time. And number 2, the question would be, could we get a bigger benefit by giving recurrent infusions or something like that? Or what exactly with the timing and dosage and everything like that? That's something we're looking at the moment.
Yeah. Now, and correct me if I'm wrong. So it sounds like maybe things like, where there's an underlying disease process that's making things worse. It seems like the most we're hoping for at the moment is slowed progression. So this could be things like ALS, maybe Parkinson's, some of the dementias as well. But the area that I'm really interested in, because these are my patients. So typically with a patient who has a protracted withdrawal injury, I actually see it kind of like a concussion. Where there is, they come off the medication, they go into a severe state of withdrawal. And then, they end up with global neurological symptoms thereafter, typically for about 18 months to 2 years. It's pretty bad, but there's this kind of steady improvement over time. This might also be similar to someone who has neuropathy following chemotherapy. There's a shock to the system. There's an injury, and then kind of things sort of gradually tend to heal over time. And so there's not really like an underlying disease process that is making that condition worse and worse. In fact, the prognosis is actually good if you kind of push out the timeline. What do you think, based on the cases you've seen and maybe talking to your colleagues and, your mechanistic understanding of these cells, do you think they would have anything to offer in accelerating healing, for those types of conditions?
100%. I think what you're talking about is actually a very good moment to act and kind of a sweet spot for healing. What's going on with a lot of these conditions is neuroinflammation, and really neuroinflammation due to cellular exhaustion. So with what you do is really wonderful, working people off of some of these medications that over time are putting either cells in a state of overworking or some sort of stress to where they're worn out. When cells are worn out, they can either enter a state of senescence. Senescence, people have probably heard of as essentially a zombie-like state. They can actually fail and undergo apoptosis, which is when a cell dies. Or sometimes they're kind of on the edge. They're just still very, very exhausted, but they're still salvageable. This is where something like Muse cells could come in handy because these cells, their mitochondria, which is the powerhouse, as people may know, it's overworked and they just need resources. One thing stem cells are incredible at is they can get to that area and they can donate things that are needed. There's actual studies out there now showing that stem cells can donate their own mitochondria to a cell that's struggling, or they can produce proteins or other things that these cells might need. So bringing it back to some of these indications, something like, let's take concussion, for example. You take a hit, your cells didn't die. They just really took an insult. They're stressed at that moment. If you had everything they needed right on site, they'd heal up to 100%. If they're not getting what they needed, that's where you may fall in the area of long-term damage. And this is partially why as we get older, we don't recover from things quite as well because the resources don't make it to that site as efficiently, and cells can't survive then. So I think you're exactly right when you're talking about the conditions you are and the benefit we could have. I think we're in a pretty sweet spot where we're talking about not cells that have degenerated or are gone, but cells that are still salvageable. They're just in a tenuous state.
Okay. Now, a lot of my patients have been really burnt by the side effects of medications. In fact, that's why they come and see me. What do people really need to know about the side effects of Muse cells? Maybe you could talk about the more common things that happen and maybe the rare but serious things people should know about.
Right. So overall, I'll start by saying these therapies are traditionally extremely safe. There's been a good amount of research into safety, if anything. If people have heard scary things about stem cells, a lot of the time these things are coming from research studies where people are tampering with cells or trying to do cellular reprogramming in a lab, but they're not necessarily things happening in real time. For me, what I see a little bit more of is people toting stem cells as a cure-all or using them for indications that I think are a little less than ideal. Things we typically see with a patient, a lot of the time patients come in, they get either a precise injection at some sort of site or they're getting an IV infusion. For the most part, what you can expect is maybe a little bit of an inflammatory response. I find that this can have to do with how much inflammation the patient has. So if a patient's dealing with a low inflammatory burden throughout their entire body, typically it's very mild, any sort of response that does happen, and we just watch and wait to see if there's healing at whatever site we're trying to treat. If a patient's coming in and they're very inflamed, for example, sometimes we get patients with autoimmune conditions or things like Lyme disease, or they have systemic inflammation just because their body's not well cared for. And when you put a strong healing modality like a mesenchymal stem cell in general or Muse cells, sometimes what you see is even more of a flare. And this can scare some people a little bit. This is a bit natural, because if you can imagine, these cells are trying to treat inflammation. You put them into an inflammatory environment and everything goes on overdrive to try to fix a little bit. Sometimes the body heals after that. Sometimes we see mixed results in between, but that's certainly, as far as contraindications are things that we should really avoid. People that are like very sick, we're cautious and we do a lot of screening. But overall, I would say there's no hard contraindications in the world of stem cells or regenerative medicine for the especially Muse cells at this point in time.
Okay. Now, part of the reason why we're talking now is there's actually been a lot of changes in state regulation around stem cells, actually. Although these are, I guess, illegal on the federal level, there are multiple states. I know Florida is one that has legalized it. Utah, where I live, has legalized it. And I think we mentioned Montana as another state. And my understanding is they're trying to go the way of, I guess, legalizing cannabis, where it's illegal at the federal level, but the states allow it. And we're just assuming that the federal government isn't going to come in and kick up much of a fuss. But this is happening now, and it is happening in the U.S. And laws like the one that passed in Florida recently that is actually allowing these stem cell treatments as long as they are made in a U.S. lab and they follow good manufacturing processes per the USA. And to me, that's really great because I know a lot of people go to Mexico. They might have really great manufacturing there. But I know a lot of my patients really love the brand of, it's in the USA, it's good manufacturing practices from the USA. And there's just, I think, a trustworthy, people trust that brand a lot more. And so what I was excited to hear is that you guys actually have a facility in Florida, and that you have some Muse cells, and you can get access to Muse cells, and patients can actually go and get them in an American clinic with American doctors with products made in the USA under good manufacturing protocols. Is all that true?
This is 100% true. And piggybacking on your last question about safety, I think when it comes to these therapies right now, the biggest thing is sourcing and quality. I think when you look back in the history of stem cells, anything that's gone wrong has typically been due to either people cutting corners in the manufacturing process, not storing cells properly, or doing risky procedures that probably would have gone bad.
I heard some horrible stories. I heard that there was a nurse at one facility and she was opening the vials and taking them, and then, obviously that's not sterile, and then they would use them on another patient, and they would transmit, an infection to them, and they would get very sick. And so, yeah, this chain of what happens to these cells, and that they, needing to ensure that they're going to, reputable places where there's a good, what do you call it?
Protocol or yeah.
Yeah, like I want to say, I know it's not chain of command, but there's like a chain that they go along where there's checks and balances, and they're not just like sitting around for someone to kind of grab. And people are going into the labs and they're making sure that they're doing things in a sterile way. I agree. I mean, that's where I've heard things really fall apart. Whether you're somewhere in the third world getting them or something like that, and that's why I like made in the USA and being done in like clinics with good oversight.
This is absolutely something I think about and very passionate about, worry about. I trained in Los Angeles doing anesthesiology. I'm used to the big box medicine practices where things are checks and balances. I've seen what an OR should look like. I've seen how medications, devices, all these things should be handled. It's extremely important. And I've seen some of these clinics internationally, and it's pretty frightening. And it's not to say that now that Florida is legal in some of these other states, there aren't going to be people out there cutting corners as well, or doing things that in a non-perfect way. But then we're always fighting this balance of if you do it the right way. We're talking about very powerful therapies that I've seen firsthand, and I would really love for people to have access to. And I'd love to see, it become mainstream. I'd love to see more studies. I'd love to see it adopted by the traditional medical system so that we can figure out what are the indications, when, timing, dosage, everything that we should naturally be doing. That being said, yes, we do BioReset Medical. We have a clinic in West Palm Beach, Florida. We work with U.S. manufacturing to make these cells. Everything is done in GMP certified facilities. We're quality testing. Then on site, we're doing our due diligence. I can say we haven't had issues with anything protocol-wise, anything infectious or otherwise frightening. We're trying to do this as trustworthy as possible. One of the things we think is if we raise the bar, everyone's going to be a little bit forced to follow, because if you bring the standard up, hopefully that drives business to some extent, but in a secondary effect also makes everyone else fall in line. So yeah, and I think also there's a number of other things that are open and available to your patients, because it's not just here's some stem cells in an IV and we're doing this lazy thing. A lot of the time there's deep testing on metabolic panels that traditional providers aren't offering, or we'll do things like a stellate ganglion block or a vagal nerve treatment to try to balance out the autonomic system of the body, things like the fight and flight or the rest and digest system. Sometimes these things have gotten out of balance over time too. So we're typically needing to take a deep dive. I think this is one of the other things that, when you go see your doctor, they're not getting the appropriate amount of time to really look at the whole picture, treat the entire body, and look at everything that's going on.
Mm-hmm. And so, Jeffrey, if someone out there listening to this is saying, hey, I think I want to try this experimental treatment, I'd like to give it a go. What's the best way they can get in touch with you so they can, book an appointment down in West Palm Beach and try this therapy out?
Yeah, so we have a few sources. You could look up just bioresetmedical.com online. My Instagram page is just my name, Jeffrey Wiegers. From there, I have all the resources people can go to, or you can email directly at frontdesk@bioresetmedical.com. From there, we usually start with a consultation. I want to make sure this is the right thing for you. I want to make sure people understand, what they're doing and what they're getting into. It's important to have all the questions answered, have people comfortable, have expectations set. But then from there, yeah, we're happy to treat as many people as we can and to do so with some integrity.
Yeah. And so this is, I'm not getting a kickback from BioReset Medical or anything like that. I'm really interested in this. And so what I want to add is if you're listening to this and you have a protracted withdrawal injury, maybe tardive dyskinesia, neurological damage from these medications, maybe even something like post-SSRI sexual dysfunction, if you are going to see Jeff or maybe go and see someone else for stem cells, I would like to hear about it. And so if you're comfortable in just looping me in on your care there and just letting me know, I'm going to report it back on my channel and through my social media. I've lost several patients to protracted withdrawal. I've had friends take their lives from this, and I know how serious this condition can be. And if there is just something that can alleviate this and make it better, I really want to know about it. And so if you have a great response, that's awesome. If you have a terrible response and it's the worst thing ever, that's still really important. And so if you can reach out to me, just email me at info@taperclinic.com, subject line Muse cells. If you're comfortable with letting me kind of ask you questions and follow along with your care, I really want to do that. So
I think this is great. I would love to go on that journey with you. And I think it'd be fantastic if we could collaborate on a few patients as well, hopefully treat a few people. I think you've got a great indication here for this. And I think if we could get that information, true data and not just anecdotes too. Like we like to collect lab data, everything, and hopefully track some of that and get that out to the public.
Great. Okay. Well, on that note, Jeff, thank you so much for coming on and sharing your knowledge with my audience. And I'm looking forward to learning with you.
Same. Thank you for having me, and thank you for your time.
If this video was interesting to you, be sure to check out this one right here.